Welcome back to Dr. Avinash Phadke Lab videos. This is Dr. Alvin Alva. Continuing with our series on the complications of diabetes, in this video we will talk about how diabetes affects the kidneys. Kidneys are responsible to remove all the unnecessary and toxic waste products from the blood by producing urine, and also maintains the balance of water and electrolytes. Urine is a fluid that is filtered from blood where the kidneys act as a filter. This filter retains substances that are needed by the body like glucose, proteins and salts while removing all the unwanted material which may be harmful to the body like urea, creatinine, other products of metabolism, extra salts and water. The kidneys can be compared to a strainer or a filter where the useful products are held back and the toxic products are removed. Over several years, as diabetes progresses, it affects the kidneys and reduces the ability to filter the blood and produce urine, and therefore can't remove the toxic substances. Let's understand how that happens. The main filtration unit of the kidney, called the nephron, is affected. In diabetes, the blood vessels in the nephron become leaky, and as a result, the body starts losing protein. The most important protein lost is called albumin. So what happens when protein is lost? Protein inside the blood is responsible to hold water within the blood vessels. If there is loss of protein, water starts moving outside the blood vessels and results in fluid accumulation and swelling all over the body, the face, the feet, around the lungs and within the abdomen. This process may start in the face and progress towards the legs. Lack of proteins within the body also makes the person more likely to get infections. To make up for the lack of protein, many patients in the initial stages of diabetes may need protein supplements. Normally, blood is filtered within the kidney at a rate of more than 90 ml of blood per minute. As kidney disease progresses in diabetics, the ability to filter blood reduces and the filtration rate reduces from 90 ml per minute to 60 ml per minute and further to 30 ml per minute. In the end stage of kidney disease, the filtration rate drops to less than 15 ml per minute. As the kidneys reduce functioning, the urine output reduces from the normal 1.5 to 2 liters per day to less than 400 ml per day. This is a sign that the kidneys are not able to filter the blood and thus produce very little urine. At this stage, diabetics will have to depend on dialysis. The dialysis machine acts as an artificial filter for the blood instead of the kidneys. In dialysis, the blood is passed through a machine which has certain filters. These filters help removing the waste products from the blood and then return the blood back to the body. There is a common misconception that dialysis is painful. However, the process of dialysis is not painful. The only painful part is when the needle is inserted into the artery and vein, like it is done for a blood test. After that, it is pain-free and lasts for about 3 to 6 hours depending upon several factors. However, there are certain side effects like low blood sugar and low blood pressure, which may produce symptoms like weakness, lightheadedness, headaches, nausea that may affect people immediately after the dialysis session. Many people who are on regular dialysis live well for several years. However, the need for repeated dialysis may add some financial strain for patients. Some patients may require dialysis up to 3 to 4 times per week, depending on how much residual kidney function is there. Those with kidney disease that is progressing may have to reduce the amount of water they consume, as well as reduce the amount of salt, potassium, and phosphorus in their diet. This is because as the kidneys can no longer filter these products, they start accumulating in the body. Increase in water and salt content can in turn increase the blood pressure and increase the strain on the heart, as well as further damage the kidneys. Many are not aware that potassium is needed just in the right amounts for our body. Too much or too little potassium can cause muscle cramps, muscle weakness, and problems with the way your heart beats. Similarly, phosphorus too is an important element for our body. But too much phosphorus can weaken our bones, causing it to fracture easily. If you are a diabetic with kidney disease, you may have to change your diet based on your blood reports in consultation with your doctor and dietitian. Good control of blood sugar and blood pressure can prevent the progression of kidney disease. To check if kidney damage has begun, a blood test known as the albumin-creatinine ratio is done. If it shows more than normal protein loss, it indicates that diabetes has already started affecting the kidneys. As always, don't self-diagnose and always consult a doctor at every stage of this disease. As the disease starts at a much younger age in type 1 diabetics, the long-term complications also start appearing earlier. This depends on how well the blood sugar has been kept under control since the diagnosis has been made. So the most important factors to prevent progression of kidney disease is to maintain good sugar control and blood pressure control in the long term, even if you don't have any symptoms. In the next video, we'll talk about the other long-term complications of diabetes. If you liked this video, please subscribe to our channel and leave a comment in the comment section. See you soon in the next video.